Hi everyone, good morning. My name is Flaxidis. I'm going to take you through the procedure followed after a patient runs away or absconds from hospital. Usually if patients going out on authorized leave on hospital grounds or outside the hospital, that is in the local community. So the most important thing you do when the patient runs away from you, just note the direction they ran towards. Then immediately call the ward if you have a phone on you. Return to the ward and then call the police immediately. When you call the police, they will want to know the description of the patient, and that includes patient's full details, names, their build, their height, complexion, their ethnicity, if they carried any cards, bank cards with them, or any medication, or they had any oyster card, or had any concerns about their mental state, should report all that. Police may ask if also they have some visible tattoos on them. Some people have tattoos maybe on their arms, on the face, or any scar, visible scar, which will make it easier for the police. So you give them all that description, the time they disappeared and how they were behaving at the time. And if you have any concerns, like for the family, you want to let them know that this patient maybe is high risk. He might run away to his family or maybe to his property. If he runs away to his family's home, he's likely to be aggressive because historically this has happened before. You should give police. And if you know the patient very well, sometimes you can let them know that he normally goes to this place or friend's place, which is in the local area. And they need to know what the patient was wearing. It's also important. Just give them the full details. Jacket, you can even note the label. If it's Gucci or Debenhams or Marks and Spencer. Shoes, what color of shoes, trainers, if it's Adidas. Just give a full description of exactly what the patient was wearing. And if there are any risk like to children or the public, let the police know everything and give you full name. After we've reported, the police request that they give you a reference number. After all this, you would have told the nurse in charge already, or the moment you come back, they are aware that the patient is run away. You have to complete the text report or incident report to report like what transpired. We went out this patient at such a time. Maybe suddenly saw the bus or saw a friend started running away. So I had to return to the ward and check. And you make a record of everything and note the space where you note the reference number. That's for future reference. So that when you call police to follow up, like if you had anything about the patient, you can always use that number and record everything on. Also notify the family, reassure them. We've notified the police, he's run away. Just in case he comes home, tell them everything. Record. We used to have a form, a wall form, but things have sort of changed. I haven't been on the clinical area of late. We used to complete a wall form which goes to the MHA, to the mental health office for full details. And in case the patient returns, at times they come back on their own accord, depending on whether, just welcome them back to the ward, ask them nicely, don't have to be too harsh with them. Check what happened, what's been, where they went, if they're okay, then request the doctor or what doctor or duty doctor to check on them, check on their physical well-being for them. Drink and food, maybe change clothes if they want to wash, and explain that they've since they ran away from the nurse, we have to suspend their leave for 24, 48 hours, or when the consultant comes back to review their leave in the